Hi there, my preggy mamas. How are you? My name is Dr. Nelima and I am a resident in obstetrics and gynecology. And recently, someone went to the hospital and she told me, you see, doc, I went to this hospital. I'm 28 weeks. They already did a HB in the first trimester. The HB was okay. They insist on repeating to know what my blood level is like. And then imagine my HB was 10 and they're telling me that is low HB. How is that low HB? These people just want to mint money from us. No, we don't want to mint money from you. We want the very best for you. So when you are pregnant, we don't want you in the first trimester. We are aiming for a HB of more than 11. If it goes below 11, then that is anemia. That is low blood levels, which we don't want in pregnancy. In your second trimester, we are aiming for a HB of more than 10.5. Then in your third trimester, we are aiming for a HB of more than 11. After you have delivered, in the first 6 weeks post-delivery, at least we want a HB of more than 10. And you see, in pregnancy, there's a baby growing, and then you have a mother. Hemoglobin is very important to facilitate the transfer of oxygen to your tissues. Oxygen, which will even reach your baby and allow normal growth. So in pregnancy, mothers are at a very high risk of getting low HB. Even if you're eating well and everything is well, you're at risk of getting low HB. And in most cases, it's physiological. Physiological means it comes about not because you have a disease, but because of the changes that are going to happen in pregnancy. And that is, so like in pregnancy, at times you find your, what you call your plasma volume, it has to increase in pregnancy. And of course, your red blood cells also have to increase. But see this plasma volume that is mostly made up of water, it's increasing at a faster rate, or it's increasing more than your red blood cells. So you find something like dilution taking place. So you tend to have this physiological low HB, but not very low, between 10 to 11 grams per DL. So why do we insist on you not having anemia in pregnancy? When you have anemia in pregnancy, number one, you as a mother, you're at risk. So what happens is that because of a low HB, there's compromised transfer of oxygen to your tissues and even to the fetus. So when this happens, things are going to take place. For instance, to your fetus, when they're not getting enough oxygen, oxygen is important for the growth of that fetus, for the growth of your baby. So you might find your baby is growing, but they become restricted. Or your baby is growing, but they have a low birth weight. Like you're 9 months and you're delivering a baby who cannot even reach 2.5 kgs. And also because of the very low oxygen reaching your baby, they're at risk of dying in your womb, something we really don't want. Sometimes in some cases, because of that very low HB and we have very little oxygen reaching your tissues, reaching your fetus, there's a cascade that is triggered in your system as a mother and you end up with preterm labor. So you find you're delivering your baby at 30 weeks, 31 weeks, and you see with preterm labor, you end up with a premature baby. Premature babies really have, at times, could have many complications that are going to take a toll on you as the mother. And then you as the mother, when you have a low HB, when you have anemia, number one, your immunity is further affected. So you're at risk of getting infections. So at times you're having these recurrent urinary tract infections and you're wondering what's the problem. Simply because your HB, your blood levels are low. And then the second thing is that as a mother, you're at risk of getting postpartum hemorrhage, post-delivery, that is bleeding after delivery. Because what happens is, you see, your uterus also needs that oxygen. All your tissues need oxygen. So after delivery, when this oxygen is not reaching your tissues well, they're not able to contract well, and it puts you at risk of bleeding more. And at times, you might not even bleed more after delivery. But when your HB is very low, even with the normal blood loss that other women go through, you find yourself getting way more severe effects, getting into shock, getting issues that other people would not have gotten at the same blood loss levels. So my preggy mamas, take your supplements, okay? Be screened. So we'll check your HB when you come. And also, towards between 24 and 28 weeks, we want to see how your hemoglobin is. In the third trimester, we want to see how your hemoglobin is. So it's not minting money. It's not that we want you to buy the drugs, but we want the very best for you and your baby. So make sure you have your HB checked. And that is it from me. Bye-bye.